Hello, Donovan here. Poliomyelitis. Poliomyelitis. This is an infectious viral disease affecting the central nervous system caused by a poliovirus characterized by muscle weakness, neck stiffness, difficulties in breathing, and fever. You have to understand that the causative organism of poliomyelitis is poliovirus, and poliovirus belongs to a family of genus Enterovirus. Genus Enterovirus, these are microorganisms that affect the gastrointestinal tract, which is the GIT. The mode of transmission for poliovirus is through fecal-oral route. When the microorganism, which is poliovirus, gains access to the gastrointestinal tract, GIT, attaches itself on the receptors known as the CD155. The CD155 then envelops the virus or fuses the virus into the host cell. Inside, the microorganism starts multiplying. Once the process of multiplication is done, the virus will be released into the bloodstream, causing viremia. With the help of blood, we need to understand that the microorganism will be transported to the brain, and now the microorganism reaches the blood-brain barrier. It crosses through the blood-brain barrier into the cerebrospinal fluid, transported to the spinal cord. Now, the spinal cord will become infected. So the inflammation of the spinal cord is myelitis. Now, when we cut the spinal cord, we are going to find the horn of the spinal cord. On the horn of the spinal cord, we find a gray matter. Gray matter is the portion of the spinal cord that controls motor activity. We want to understand poliomyelitis. So now, since the poliovirus has affected the gray matter on the spinal cord, hence we are calling it poliomyelitis. The gray matter becomes affected. Polio means gray. Myelitis means inflammation of the spinal cord. So when we are talking about poliomyelitis, we need to understand that we are simply in general talking about the spinal cord, because the poliovirus attacks the gray matter on the spinal cord, hence coming up with the condition known as poliomyelitis. Others, they call it acute flaccid infection or acute flaccid myelitis.